Okay, so this session is on anesthesia. So, what you understand? It's not what I understand of anesthesia is that anesthesia, the discovery of anesthesia starts with uh, ether, and so this ether, uh, what you call as so okay, so somewhere around 1800s. So somewhere around 1800s, there was a experiment by Humphrey Davy, and that experiment was about how uh, advocation of this anesthesia for experimentation, and so later on you have the Morton's experiment uh, with ether for removing tooth, and later on there is an experimentation with Simpson, who used anesthesia for childbirth, and later on there is also mention of uh, Queen Victoria of using anesthesia for her birth of the seventh child, and what you call as uh, this anesthesia. So mainly the classification of this anesthesia goes like that. It has inhaled anesthetics, and also IV anesthetics, and also the uh, another type of anesthesia is about uh, ligno. Okay, it's a local anesthetics. So local anesthetics are act only on a particular location. So after that, there are some analgesics, especially drugs of abuse are also uh, similar to analgesics, which are very useful for ameliorating the uh, pain, and uh, so what is uh, uh, observed here is that's okay. I want to read out from case discussion in Lange Pharmacology flashcards. It is from the fourth edition of the Lange Pharmacology flashcards. So the case discussion is on succinylcholine. So it's a skeletal muscle relaxant. So what is okay? So inhaled uh, uh, anesthetics, IV anesthetics, and also what you call analgesics are there, and skeletal muscle relaxants are there. So for pain receptors, nociception. So nociception is a vital receptor in the human system, which is useful in ameliorating the pain. So this pain can be uh, 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 of of disgusting type. So, uh, let me read out from the case study. So the case study goes something like that. So while a moonlighting with the ambulance company, you are called to see a 43-year-old man who is in a severe respiratory failure secondary to status asthmatics. He is unable to speak and he is quickly tiring from laborious respiration. With paramedics at your side, so you decide to perform a rapid sequence intubation at the scene before bringing the patient to the hospital. So in order to perform a proper endotracheal intubation, you will require the use of paralytic agent with rapid onset. So you ask the paramedic to administer a depolarizing neuromuscular blocker, and you begin to closely monitor the patient for possible bradycardia and other cardiac uh, arrhythmia. So that you may result from the administration of this medication. So what is known as succinylcholine. So succinylcholine is a skeletal muscle relaxant. So uh, while talking about the skeletal muscle, uh, 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 there are neuromuscular junction is uh, of uh, consideration. So neuromuscular junction is there. So postsynaptic and presynaptic uh, neuronal synapses are there. So these postsynaptic and presynaptic neuronal uh, synapse. Uh, so mostly so there are various neurotransmitters like dopamine, uh, adrenaline, acetylcholine, so 5-HT, and various other neurotransmitters are there. So these neurotransmitters play a vital role in the transmission of the uh, new transmission of whatever sensation living organism can feel. So okay, so I will read out the answer for that uh, uh, what you call the case study from Launch Pharmacology flashcard for fourth edition. So so the mechanism of action of succinylcholine is a depolarizing neuromuscular blocker that competes with acetylcholine to reversibly bind to the nicotinic receptors at the neuromuscular junction. Initial binding of succinylcholine to these receptors results in continuous new depolarization at the neuromuscular junction with resulting muscle fasciculation. This is uh, known as phase 1 blockade. There is no antidote for a phase 1 blockade, and cholinesterase inhibitors will only potentiate the block. After a short period of uh, time, the ion channel associated with the nicotinic receptor begins to repolarize. However, the receptor is desensitized by continuous interaction with succinylcholine, and therefore the receptor will no longer transmit an action potential through the neuron even if the receptor is activated. This is known as phase 2 blockade. It can be resolved with cholinesterase inhibitors such as physostigmine. So clinical uses of succinylcholine. Succinylcholine is so whenever there is okay, something like nerve gas poisoning. So something like nerve gas poisoning, uh, you have the blockade of skeletal muscles. So what uh, is observed is that there is some kind of paralysis, so respiratory paralysis, and okay, also so skeletal muscle paralysis. So clinical uses of succinylcholine is used to produce muscle paralysis for endotracheal intubation during surgery or emergency procedures. Side effects: hyperkalemia and hypercalcemia and nausea, vomiting, muscle soreness, rhabdomyolysis, apnea, cardiac arrhythmias, and bradycardia. Other when succinylcholine is administered with halothane, malignant hypothermia can result. Malignant hypothermia is characterized by muscle rigidity and elevated body temperature and is treated with dantrolene. Okay, there is another. So there are a few other case studies there. So another one is on a 8-year-old patient with cystic fibrosis is admitted to the hospital for treatment of pneumonia. The attending pulmonologist would like to perform a bronchoscopy in order to obtain biopsies and mucus samples, but he will require the aid of anesthesia to relax the patient. So you, as an anesthesiologist, are asked for assistance to in providing adequate neuromuscular blockade for this short procedure. So you decide to use a non-depolarizing neuromuscular blocker, which is short acting and easily reversible, uh, and thus it is quite appropriate for use in this situation. So uh, is so what is observed uh, so okay, the answer for that case study would be rocuronium. So rocuronium, so similar drugs of rocuronium uh, are vicuronium, atracurium, and cisatracurium, tubocurarin, and mivacurium, rapacuronium, and pancuronium. So the mechanism of action: rocuronium is a non-depolarizing neuromuscular blocker that acts to competitively bind nicotinic receptors at the neuromuscular junction. Rocuronium does not activate the nicotinic receptor, so, but instead it acts to prevent acetylcholine from binding to and activating these receptors, thereby causing the neuron to remain inactivated with resulting inhibition of muscle contraction. So, clinical uses. So, rocuronium is used as an adjunct to general anesthesia, induction to reduce skeletal muscle contraction for the facilitation of endotracheal intubation. So, side effects: hypotension, tachycardia, prolonged respiratory depression, and effects of rocuronium can be reversed with administration of cholinesterase inhibitor and neostigmine, which acts to increase levels of acetylcholine in the neuromuscular junction and thereby helps to overcome the competitive binding of rocuronium uh, nicotinic receptor. So there is another case study given. When talking about this general anesthetics, you have uh, uh, inhaled anesthetics and IV anesthetics, and other than that, local anesthetics are also there. So, this inhaled anesthetics mainly like ether and uh, also chloroform and various other drugs are there. So for inhalation, so there is a simple experiment on this general anesthesia. So um, what you call anesthetizing a laboratory rat for an experiment. So what uh, 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 what is done in that experiment is that mainly in that experiment you get a laboratory rat, and this that laboratory rat is kept in a anesthesia chamber. The chamber can be made up of plexiglass or maybe a simple glass. That chamber mainly would be transparent or non-transparent. It depends on what type of container or instrument that is. So depending on that chamber. Okay, rat is rat, mice, whatever organism is used in the experiment. That animal is put into that chamber, and cotton is soaked in uh, uh, soaked in what you call uh, soaked in that ether, chloroform, whatever anesthetic solution is there, and in with that uh, 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 with that solution, the uh, what is obtained is that after like few minutes the rat goes into a comatose stage. So in that comatose stage, after that, what experiment is that done is that spinal dislocation is used. So what I have um, done with the animal rat is only a spinal dislocation is used. So you catch hold of a laboratory rat's head, and with another hand you catch hold of the tail, and spinal dislocation is done, and whatever dissection is to be carried out, those experiments are done. So with those uh, okay, so with those experiment, some okay, mainly tissue isolation, whatever operative procedures are to be carried out. So these procedures are done, and if okay, since spinal dislocation is done, the animal cannot be brought back to its original mm, uh, condition. So mainly that animal is uh, either would be discarded, or uh, 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 or for any histological analysis, tissue samples are taken from that animal, and similar things are done. So so another case study is on local anesthetic discussion. So a 31-year-old man presents to the emergency room for having been involved in bar brawl at a local establishment. He has sustained a deep cut to his left forearm after uh, uh, thoroughly cleaning. So he has sustained a deep cut to his left forearm after thoroughly cleaning the wound and confirming that there is no residual debris in the wound. You explain to the patient that he will need stitches. He asks whether uh, he will feel any pain during the procedure. That uh, you reassure him that you will administer a medication to the area of wound that will dull his sensation to pain by blocking neuronal sodium channels. So local anesthetics. So in local anesthetics, yeah, the sodium channels and what you call in the cell membrane. In the cell membrane, there are H gate and M gate. So these H gate and M gate act in a contradictory manner, and in this manner, the action of ion channels that passes through this H and M gate is regulated. So mainly there are toxins like saxotoxin, tetrodotoxin. So these saxotoxin and tetrodotoxins are mainly used for you use this saxotoxin and tetrodotoxin. It's not used actually. So they are poisonous toxins secreted by animals for their defense. So, if anyone comes in contact with these creatures, the person would get infected with that toxin, and mainly in uh, uh, mainly in some countries, these poisonous creatures are used as delicacies. Okay, so mainly some chefs are very uh, uh, have good skills in preparing these animals for uh, their clients. For okay, so local anesthetics. Uh, so local anesthetics can be divided into two groups: esters and amides, based on differences in chemical structure. Esters include procaine, cocaine, tetracaine, benzocaine. Amides include bupicaine, lidocaine, and mevicaine. So mechanism of action. So local anesthetics act by blocking sodium channels on neuronal cell membranes, thereby decreasing the activation of these neurons. So nerve blockade tends to occur most rapidly and the myelinated fibers of the small diameter. So that would be like mechanism of action, blocking of sodium channels. So clinical uses. So clinical uses, the local anesthetics are used during minor surgical uh, procedures in which sensation tends to be blocked in a localized area of the body, but unconsciousness is not necessary. So side effects: seizures. So seizures and neurotoxicity associated with systemic uptake of drugs. So myocardial depression and hypotension associated with bupivacaine, and hypertension and cardiac arrhythmias associated with cocaine. So vasoconstrictors with epinephrine are often given locally with local anesthetic, so that the rate of systemic absorption of anesthetic is decreased and a more effective nerve block is obtained, since more anesthetic remains in the desired area. So in general, esters tend to have a shorter duration of action than amides, although tetracaine has a reasonably long duration of action. So while talking about the not talking, so the uh, okay, so GABA A and GABA B are there for uh, in general anesthetics. So in GABA A and GABA B, so these GABA A and GABA B are okay, almost like pentameric structures. So okay, they have a uh, they are almost like okay, they you can't call that G protein coupled. Okay, similar. I'm not sure of that ion channel transmission. So G protein coupled maybe. So so there is another uh, uh, case study. So when within 2 weeks after major abdominal surgery, a 56-year-old man goes into fulminant liver failure and dies. The case of the liver failure is unknown since he had no signs of liver uh, disease before his surgery. Biopsy during autopsy shows massive centrilobular uh, liver cell necrosis. You hypothesize that the patient may have suffered a rare complication of general anesthesia and that the medication as opposed to a pre-existing liver uh, condition was responsible for his death. So, general inhaled anesthetic agents. So, the answer would be general inhaled anesthetic agent. So, okay, reading out from this lunch pharmacology flashcards are a little bit uh, easier, I think, rather than talking from the memory. So, general inhaled anesthetic agents. So, similar drugs. So, examples of general inhaled anesthetic include halothane, isoflurane, desflurane, sevoflurane, enflurane, and methoxyflurane. So, now exact mechanism of action of the general inhaled anesthetic is not completely understood. So, recent research has demonstrated that the general anesthetics directly activate GABA A receptors throughout the brain, thereby leading to decreased neuronal activity. So, clinical uses so used for general anesthetic induction and maintenance for surgical procedures. So, all of the general inhaled anesthetics can cause myocardial and respiratory depression. So, GI upset, they can increase cerebral blood flow through vasodilation. So, the specific side effects. Okay, discussing about the side effects. Specific anesthetics are associated with certain side effects. Halothane has been shown to cause fulminant hepatic necrosis, hypotension, cardiac arrhythmias. Methoxyflurane and enflurane uh, have both been shown to be nephrotic, uh, toxic, and enflurane have has also been associated with seizure when halothane is administered with succinylcholine. The malignant hyperthermia can result in genetically susceptible patients. Malignant hyperthermia is characterized by muscle rigidity and elevated body temperature and is treated with dantrolene. So there is another case study. So, a 73-year-old man is brought to the emergency room complaining of palpitations. An electrocardiogram reveals that the patient is in ventricular tachycardia. This blood pressure is marginal at 90 to 60 millimeter mercury. So, you decide to electrically uh, cardiovert this patient to prepare the patient for cardioversion. You administer a short acting intravenous anesthetic agent that acts to prolong uh, uh, activity at the GABA receptor, but that also causes only minimal hypertension. So general intravenous anesthetic agents. So general intravenous. So I had an experience. So experience with what? Okay. Uh, anal inflammation. So anal inflammation, some general. Okay, you call lignocaine general anesthetic or local anesthetic. So these anesthetics are used to ameliorate the pain and anal inflammation. So this uh, kind of uh, amelioration of pain uh, are the main signs of anesthetic drugs. So, okay, other than that, anesthetic drugs are used for intubation. So, various intubations are used: nasal intubation, oral intubation, anal intubation, urogenital intubation. So, okay, various intubations are there. So, whatever intubations are there, person should be under the influence of anesthesia. So, before uh, uh, doing any kind of intubation, anesthetic drugs are of uh, very of vital importance. So, general intravenous anesthetication, similar drugs, so it includes propofol, etomidate, ketamine, and benzodiazepines. C benzo. Okay, so barbiturates, opioids, propofol. So, mechanism of action of propofol is unknown, but act to uh, uh, prolong activity at the GABA receptor, so thereby potentiating the effect of GABA at the postsynaptic neuron. So intermediate acts to prolong activity at the GABA receptor, thereby potentiating the effect of GABA at the postsynaptic neuron. So ketamine, PCP analog that acts as an NMDA receptor antagonist, thereby decreasing neuronal conduction. So propofol used for induction and maintenance of anesthesia and conscious sedation. So etomidate used for induction of anesthesia, conscious sedation. Ketamine used less often due to side effect profile, can be used for minor surgical procedures, and local anesthetics for neuropathic pain may be used in acutely suicidal patients. So propofol, hypotension, chemical pancreatitis, etomidate and vomiting, myoclonus, adrenal suppression, ketamine, hallucinations, cardiac and respiratory depressants. So another thing is on opioids. So in opioids, yeah, the morphine, codeine, oxycodone, and hydrocodone, and hydromorphine, and heroin, meperidine, fentanyl, and dextromethorphan. So talking about this general anesthetic, something which is of importance is the uh, malignant hypothermia. So malignant hypothermia is uh, uh, important thing. So what this malignant hypothermia uh, uh, is so malignant hypothermia is what happens is that uh, ranodin receptors are there. So ranodin receptors uh, uh, so you have the calcium, so calcineurin. Okay, so not calcineurin. So there are calcium binding molecules. So calcium binding proteins or molecules are there. So these calcium binding and protein binding molecules, what they do is that they uh, they help in calcium binding. So the antidote for this malignant hypothermia is mainly like use of dandrolin. So use of succinylcholine can cause this kind of malignant hypothermia. Uh, but least nitrous oxide. So nitrous oxide was not discussed at the beginning of the session. So nitrous oxide was not discussed at the beginning of the session. So nitrous oxide is uh, 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 nitrous oxide is uh, 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 what you call uh, 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 it's called laughing gas. So nitrous oxide is a laughing gas which uh, 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 is uh, used in the uh, for nitrous oxide is used for the experiments of nitrous oxide with nitrous oxide can be traced back to the experimentation of Humphrey and Davy. So this nitrous oxide, um, along with xenon, isoflurane, thiopental, alpha xylon, are used in uh, 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 for inducing anesthesia. So there are various incidents of use of anesthesia, and going back to the whole mechanism, there is something like uh, you call that what is called what it is called is uh, why what it is called is uh, you call that minimum alveolar concentration. So minimum alveolar concentration is there. So minimum alveolar concentration, uh, I think someone was trying to watch this video. So someone was trying to watch this video. So another so the uh, so minimum alveolar concentration is there. So minimum alveolar concentration can be defined as something like uh, uh, so whenever an anesthetic is infused into an organism, so what this organism is whatever anesthetic is infused into the organism, the concentration that is uh, obtained in that organism to induce uh, what you call that induce a stage where nullifying of the pain occurs. So maybe uh, uh, there are different stages of surgical anesthesia. So surgical anesthesia uh, has different um, uh, stages. So almost like four planes of surgical anesthesia is there. So four planes of surgical anesthesia. So these four planes of surgical anesthesia uh, uh, can be studied in uh, detail. So, first stage of anesthesia is so almost like four stages of anesthesia are there. So every stage, so the last stage would be something explained in the clinical pharmacology for prescribing is has been it's like overdose stage. So this overdose stage, okay, so before that, I have to go to the first stage of anesthesia. So the first stage of anesthesia, what it describes is that uh, so so what you call that first plane of anesthesia, uh, okay, before that you have the various uh, okay, neuromuscular block. Okay, the first stage of anesthesia uh, is mainly with the induction of anesthesia. So, what is described in this clinical pharmacology for prescribing uh, uh, by clinical pharmacology prescribing is the stages of anesthesia is the stage one, also known as induction, is the period between the initial administration of induction agents and the loss of consciousness. So stage 2, also known as the excitement stage, is the period following a loss of consciousness and marked by excited or delirious activity. So, stage 3 or surgical anesthesia is there. So, during this stage, the skeletal muscle relax and vomiting stops and respiratory depression occurs. So, also known as overdose. So that would be the last stage of uh, last stage of anesthesia. So four stages of anesthesia. So sometimes in a kind of hurry or some kind of it's a kind of haphazard thinking, so you forget even the four stages of anesthesia. Okay, sometimes in between some stage explanation may be remembered, but this kind of memory loss is prevalent, and uh, when there is consistency, when maintaining consistency is tried to induce. So, trying to induce a consistent stage, what is observed is that it's difficult to remember some things that are frequently uh, used in study. So, in inhaled anesthetics, so there are blood partition coefficient, and in that blood partition coefficient, water blood solubility and oil gas partition coefficient, lipid solubility, second gas effect is there. So second gas effect, and along with minimum alveolar concentration, so intravenous agents, what you call, even benzodiazepines and barbiturates can induce anesthesia. So okay, there are some anesthetics which are classified under benzodiazepines and barbiturates. So uh, okay, there are various channels, NMDA channels, and okay, so ketamine, fentanyl, and propofol. And okay, phenytoin. So phenytoin is not there. So I just the slip of tongue is there happened. So in phenytoin, uh, 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 so what you call that? Okay, so uh, uh, there are some theories of anesthesia. So many simple unreactive compounds produce general anesthesia. The extreme example being the inert gas xenon. So the early theories of anesthesia. So anesthetic potency is closely correlated with lipid solubility. So uh, Overton Mayer correlation, so not with chemical structure. So the early theories of anesthesia postulated interaction with uh, uh, the lipid membrane. Bilayer recent work favors interaction with membrane ion channels. So the most anesthetic enhance the activity of inhibitory GABA. So various theories are there. I don't know what theory is really valuable, or some whether it is effective or not. So this theory postulation is so sometimes illogical. Okay, maybe logical also. Uh, Never tested a theory. So the whole thing about this anesthesia goes on like that is that okay. So I was reading some case studies at the beginning of the beginning of the session, and so what you call this okay there are okay. So I should be elaborating on the mechanism of action. So mechanism of action. So let me try to dig up the mechanisms. Okay, not mechanism of action exactly. So how this skeletal muscle. So in skeletal muscle, uh, 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 relaxant, so non-depolarizing and repolarizing skeletal muscles are there. So this depolarizing and non-depolarizing uh, uh, skeletal muscle uh, 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 okay, non. So, what is observed in the skeletal muscle is that in skeletal muscle uh, there are type 1 fibers and type 2 fibers. So, for the pain perceptions, so there are type A, type B, and in that alpha, delta, beta, gamma. So, it is you. It is there in the pain perception. So, in pain perception, uh, uh, so pain perception, what is observed is that uh, this pain perception. So pain perception, there are some fibers, alpha, beta, delta, and uh, yeah, okay. In a similar way, for uh, what yeah, for skeletal muscle fibers, type 1, type 2 fibers are there in that alpha, beta. So spiraling of the nerve bundle, nerve bundle, something like that happens in the skeletal muscle. In that you have the depolarization and repolarization. So in that uh, okay. So in that thing, uh, so what I was talking about, this neuromuscular blockade. So you call it's called a neuromuscular blockade. So general anesthesia is just so gases in excitatory. What? what you call uh, excitatory neuromuscular transmission is uh, membrane depolarization. So neuromuscular blockade, action potential. Okay, before that, what is this thing is that okay, there are in anesthesia there are two things which uh, mainly it's uh, okay, anesthesia, neuromuscular blockade, and okay, it has muscle paralysis have is described. So in that, it must be really NMDA uh, 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 receptor. So okay, along with GABA also. So what is uh, NMDA? Okay, there are other receptors also, but I am not able to recollect. So, uh, going live on this aspect. So, uh, okay, NMDA receptor. So, uh, in opioid analgesics, what is observed in this opioid analgesics is that uh, 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 in opioid analgesics, mu, delta, kappa. Uh, so in opioid analgesics, there are this it's acetylcholine nicotinic receptor. So nicotinic NM receptor. So uh, okay, there is nicotinic and muscarinic receptors in a skeletal muscle transmission. Skeletal muscle transmissions. Okay, so nicotinic and muscarinic receptors are there. Nicotinic. So it's so when talking about this. Neuromuscular transmission, so mainly acetylcholine is involved. So in acetylcholine is involved, what is observed is mainly on uh, uh, about what is okay, acetylcholine is there. So and nicotinic receptor. So whenever this acetylcholine leaves the presynaptic cell and try to get into the postsynaptic cells. In the postsynaptic cells along the neuromuscular junction, there are uh, what you call receptors are there. So it binds to that receptor and tries to elicit an action. So I don't know whether that would be really a uh, uh, G protein coupled receptor or some other kind of receptor are involved there. So the thing is that uh, uh, while there are other classification for this uh, uh, non-depolarizing blocker. So, short-acting, long-acting agents of anesthetics are there, and okay, so there is uh, the things like okay, so there are some deep classification for this anesthesia. So. Uh, don't want to go into that aspect. Maybe uh, don't know whether that is uh, authentic or not. So, uh, so GABA A, GABA B receptors are there, NMDA receptors. and so so cardio. Okay, so okay, whatever paralysis happens when infused with uh, these anesthetic agents. So uh, uh, so okay, ketamine, naltrexone. So naltrexone, so for okay, opioid analgesics, various things are like codeine, uh, morphine, naltrexone, meperidine. Okay, so meperidine is the thing or not? I'm not sure about that. So, what uh, it's observed is that okay, there are phases in uh, uh, induction phase. Okay, that going into that detail won't be of any use now. So the thing is that uh, whether that thing is of any okay, so how anesthetic is soluble in lipid, okay, how it penetrates a lipid bilayer and induces uh, anesthesia. So epidural and spinal anesthesia. Now things are being recollected about this epidural and spinal anesthesia. How a person, look, it's not about person. It's okay. So in certain procedures, epidural and spinal anesthesias are used. So maybe okay, yeah, the lumbar. Okay, it's mainly through the lumbar, not sacral. So lumbar vertebrae. I'm not sure about what location is that. So they mainly through the lumbar vertebrae. Uh, this anesthesia is given. So even in atropine poisoning, okay, so in atropine poisoning, some kind of anesthesia. So numbing of tissues, skin tissue. So numbing of skin tissue would be an example how uh, it's like a local anesthesia. So where sensation would be lost uh, for a particular duration. What uh, is observed is that okay, so other aspect of anesthesia. This session is going to be ended in another 1 minute. So it's almost like going to be 1 hour session, and so that this session okay, I think there is nothing much here. Analgesic. So analgesics. Okay, drugs of abuse, everything has analgesics effect. So even in the drugs which alcohol, amphetamines, okay, not to include benzodiazepines and other things. So the okay, the session is almost going to be 1 hour, and it is better to end this session and not to continue anything. So this is anesthesia from my viewpoint, and there is nothing new in this.